Now we're excited to be presenting the next panel. I'll be moderating this discussion. It's on the mental health epidemic and the crisis at the workplace. So as we all know, the pandemic has profoundly altered our social and working environments completely across the globe, also in India. Of course, there have been so many things that have changed: social distancing policies, mandatory lockdowns, isolation periods, the anxiety really of getting sick and not knowing what's going to come next, along, of course, with suspension of productive activity, loss of income, fear of the future, and so on. So we're going to be talking about these issues and what can be done structurally to reimagine healthcare. Remember that, of course, is the rubric or the framework under which we're holding all of these conversations. And I'm going to be introducing this very exciting panel that we have right now. We have Dr. Soumitra Pathare, who's a consultant psychiatrist and director, Center for Mental Health Law and Policy. In the past, he has provided technical assistance to the Ministry of Health as well. There you can see it on your screens. He's also helped in drafting India's new Mental Health Care Act 2017, which takes a rights-based approach to mental health care. He was also a member of the Mental Health Policy Group appointed by the Government of India to draft the first national mental health policy, which was released in October 2014. We also have with us Dr. Rajiv Mehta, who's been working as a senior consultant psychiatrist at Sir Gangaram Hospital, New Delhi. And in 2018, he became the vice chairperson there of the Institute of Psychiatry and Behavioral Sciences. Additionally, he's also working as an advisor for the Indian Council for Juvenile Research. Dr. Mehta is also a general secretary of the Indian Association of Private Psychiatry, which is of the Delhi chapter. And he's the author of the book, Speak to Anyone Easily. So we have two book authors. I'm going to be introducing the next person as well. And he's also authored multiple articles on various aspects of mental disorders in leading national magazines. And we have our third panelist. We have Ms. Kamna Chibber, who's the head of mental health at the Department of Mental Health and Behavioral Sciences, Fortis Healthcare in New Delhi. And she has a particular interest in working in the domain of relationships, trauma, abuse, and the impact of personality-related variables in mental health. Ms. Chibber works extensively with schools, corporate organizations, NGOs, and has a strong focus on generating awareness relating to mental health. Through her writing, blogs, and media interactions, she's also worked towards the larger goals of inclusiveness and removing of stigma and busting of misconceptions relating to mental health. As a coincidence, I have your book, Ms. Chibber, Age of Anxiety, I have, which you co-authored with Amrita Tripathi. Okay, so I'm going to start this conversation. One of the set of questions I'm going to ask you all is for your quick take on the issues of what has changed now in the post-pandemic world as we're entering the post-pandemic world. What was broken in the workplace specifically before? What changes were needed? And of course, the pandemic came along and shut us all out of the workplace. So now when we're going back, are we seeing those changes or are we headed towards business as usual? So I'm going to ask Dr. Pathare to start first, and then Dr. Mehta, and then Ms. Chibber.
Sorry about that. I had to unmute myself. Thanks, Venkatesh, for the question, and thanks for the invite from Boom Live for this talk. By the way, you got three authors. We just published a book on suicide prevention called Life Interrupted for the general public in terms of policy interventions. And one of my co-authors on that is Amrita Tripathi.
Yes, that's the fourth book in the series. Yes. Thanks for pointing it out. And that's a really nice coincidence.
Yeah. I'm sure my publishers will be very happy for me plugging these things in. You know how it goes. So anyway, to answer your question specifically, look, I think that we are, the pandemic has become a little bit of a watershed in many ways. Watershed for various reasons. Like before the pandemic, I suspect people thought, well, mental health problems happen to other people. They don't happen to me. Or they don't happen to people like me, or they don't happen to my family. And I think what the pandemic brought home to everyone was that, well, anyone can get it, including me and people like me and my family. And so suddenly we are hearing a lot of talk about mental health. Like before COVID, we wouldn't have had this panel, for example. So there is a lot more talk about mental health. But let's also be honest that what we've got is a whole bunch of problems, especially at workplace, which antedate and predate the pandemic. And going back, you're just going back to the same situation, in many ways, actually worse situation for many people. So they're not going to go away, and those problems continue to remain, and those problems have not been addressed by either by government is a large employer. Don't forget, actually, the government is a very huge employer. So the workplace is government. Also remember that the defense forces of various kinds, the armed forces, police, are another big employer. We always think of workplace as just being people in the private sector, but actually those are big employers. And the biggest group of people in the workplace, in a way, who get nothing and nobody talks about them, is the informal workplace. The informal or even the non-formal workplaces where people are not organized, or what is called unorganized sector. So, these are all the areas where workplace issues remain. So I'm sure we'll be able to talk about it, but I just wanted to lay out, like, that's the canvas on which we are really talking about.
Yeah, it's a pretty huge canvas, come to think of it. We don't realize it. I'll come back to you, Doctor, for an understanding of, the basic questions I asked, also from a policy perspective. And when I say policy, I mean, obviously government policy, but also maybe corporate policy. But let me get a word in from Dr. Rajiv Mehta. Doctor, do you see any changes? Did you see a big change when it came to specifically maybe medication related to several mental health issues before the pandemic, during the pandemic, and now in the post-pandemic world?
Thank you, Venkatesh, for inviting us on this beautiful and wonderful topic. Yes, as Dr. Pathare has summarized very well, the acceptance is increasing. The stigma is decreasing. And among the workplace, which I also wish to include, will be the home front for the females, and in the school for the teachers as well as the students. So they may also be included in the policy things. But yes, coming to your specific question regarding medication, the use is definitely increasing. There are various factors to it. Number one, the incidence is increasing as such because of the various stressors. The stress is increasing. Because of the various reasons, the consequences in form of mental health issues is increasing, and the acceptance is increasing. Recognition is increasing. So in totality, the workload over the doctors who are handling the mental health issues, the mental health professionals, is increasing. In fact, some of the doctors, even the psychiatrists, have come under burnout with themselves also. So definitely the things are
interesting to see that trend. A little later in the conversation, Dr. Mehta, I'm going to ask you that question about, typically we always ask, right? Is there a danger of over medicating? Is there, are we emulating countries where the answer to everything is a medicine? So I'm going to ask you that loaded question a little later in this conversation.
I'm going to answer you that.
Yes. Ms. Chibber, I want to ask you, what do we mean really if someone comes to you and talks to you about mental health at the workplace? Can we have clear distinctions? Is there such a thing as mental health at the workplace, mental health at home? Is there a useful distinction, or is it a distinction that kind of doesn't take into account a person's overall mental health?
I think we would all agree, all of us who are on the panel here today, that you can't segregate or compartmentalize mental health into different parts to say that, I can have good mental health at my home, but not good mental health at my workplace, because there will always be at the core of it all, or at the crux of it all, is the self of the individual. If the individual is having a challenge in managing their mental well-being, which is reflecting in the ways in which they're thinking, which is reflecting in the ways in which they are processing things, in their moods, in the kind of experiences they're having, in the kind of reactivity they're having, it's going to have a spillover effect into every aspect of their life. An individual may have a more difficult situation in a particular context, but that may not just remain stuck to that specific context, because when the person is getting impacted, the impact happens overall. So you can't segregate it and say that my workplace is not fine, so only here I will be having challenges in coping alone. It may start like that, but as soon as we recognize that there is a mental health related illness which has emerged for an individual, it will impact their functioning across all domains of their functionality. So social, occupational, their personal zones. Everywhere there will be an impact. There will be an impact in how they're functioning. There will be an impact in the ways they're being able to take care of their own selves. So it's going to be a more global aspect which would come into play in that context.
Okay. Going forward, I'm going to ask you whether there's an increase in acceptance for people to talk about mental health at the workplace. I know on one-on-one sessions, there is a high acceptance, or maybe there may be a high acceptance among friends and family. Maybe I'm mistaken. That's a hypothesis I've made. But I also want to explore that topic. But Dr. Pathare, going back to really what you first pointed out, and I'm just thinking about the implications of what you said about the government being an employer. I mean, if we think about it, the government is probably the single largest employer in India, right? Especially if you now start counting state governments and city governments and so on and so forth. So when it comes to policy, I'm assuming that instead of dividing between, government and corporation and the workplace and dividing it that way, we think about the workplace for everyone. Is there an increased acceptance among in various governments that, yes, we need to think more about mental health policies, we need to design better workplaces, and we also need to ensure that there is adequate budget? Do you see that kind of thing happening?
Well, unfortunately not. And I think that's what worries me. And I'll tell you, I think we should step back a little bit. What employers have done, and which I think in many ways the mental health professionals have been kind of complicit with, is that we made the mental health problem at the workplace an individual issue. Okay, so it's all the individual's problem. The individual needs help. And it's individual vulnerability. So, we made it like it's about the individual. It's about you need help, you are depressed. And what we've actually not done is to step back and say, hang on, what kind of environment are we living in? It's a little bit like, let's say you're living in a polluted environment and then everyone's getting chest problems. And you say, well, you got a problem, you're getting a chest problem. Well, there's pollution all around. What are you doing about that? So similarly, in the workplace with mental health issues, it's all become about individual vulnerabilities, about identifying the individual and helping the individual, with very little attention being paid to the kind of environment that is created by the employer, whoever that employer might be, in terms of their policies, in terms of resources, in terms of how people are treated, in terms of addressing the workplace toxicities that are created by the structure of the work itself. Now that is very conveniently avoided out, and it's always put out as an HR problem. An HR problem meaning, oh, it's a human resources, we have to do something for the people. But if you talk to the human resource, very often we get human resource people coming to us and saying, oh, we want to do something at the workplace for our people. And you say, okay, we need to do a 360-degree analysis of it. It's not just individual vulnerabilities. It might have something to do with how your people who supervise your managers behave. It might have something to do with your policies. And then usually like, we don't really look into all of that. Can you not just provide some counseling? Can we do something which will improve wellness for them? So, I sometimes feel that employers are really, it's about lip sympathy to this whole process, to ensure that they are seen to be doing something, to have something to put into their annual reports, and to be seen as a positive employer, rather than actually get into it and address the issues that are there. I'm sorry if I sound negative, but that's the reality of what we come across in the workplace today.
No, you're drawing out a picture for us that is rooted in reality, as you said, and we're trying to build towards a better future, of course. So much appreciated. Dr. Mehta, that question that I flagged earlier, and I also want to add something else. There is increasing acceptance of the need for everybody needing mental health and good mental health, but mistrust remains, distrust remains. We do know at Boom Live that we do see a lot of misinformation related to mental health as well. And of course, you do have very valid criticisms of the medication aspect of treating people. For example, there was a question recently that the new DSM manual talks about a grief disorder. If you're in grief for more than 1 year, for example, it paves the way for maybe medicating it. So I'm asking you this question from that perspective. What would you have to say to that, especially speaking about how we're going to build towards mental health at the workplace?
See, definitely there are many misinformations. I will say there are many myths. If we understand, every day some of the or the other of the new diseases are being discovered. Does that mean that they were not earlier? Definitely they were there earlier, but they were not detected because the things were not there. Right? Now, if you see an example of eyeglasses, we know how much the deficiency in the vision is, but which chemical of the eye is deficient, we don't know. Right? Now, try to understand. If there is a head injury, the behavior will change. If there is a stroke, the behavior will change. So, from where the behavior is being controlled, it is being controlled by the brain. But as we cannot judge the eye chemical, we cannot judge the inside chemical. There is a limitation. But the behavior is being run by the chemicals: touch, pain, pressure, vibration, temperature, because different chemicals to the brain. Right? So, mental illnesses are similar to the physical illnesses. Insulin deficiency is diabetes, thyroxine deficiency is hypothyroid, serotonin or other chemical deficiencies is depression. So, it's a misnomer to say that we are giving them medication. If we
Right.
are just if there is a calcium deficiency, we are giving calcium in a form of tablet or injection. So we are giving the bone vitamins. If there is a iron deficiency, we are giving the blood vitamins. If there is an insulin deficiency, we are giving the hormones. Similarly here, whether to call them as antidepressants or the brain supplements, it is how you say perfectionist or sulky, crazy or genius, nadan ya badmash. So
Great.
they are basically not the medication. They are basically just supplementing the deficiency of the brain. Right? Now, if we take an example of diabetes or hypertension, lifestyle changes definitely helps in them. But still people keep on taking medication. Why? Because they will help in a pre-diabetic or a pre-hypertensive state or a preventive step. So similarly here, many things help in a milder form of the disease or in a preventive step. But once it has crossed the boundary of moderate to severe, then definitely we require the so-called antidepressants. In my language, they will be cognitive enhancers or brain supplements.
Got it.
And we don't have a choice. We don't have a choice either to pick the illness or the treatment. If we keep on waiting to work on ourselves, it takes such a long time. By that time, we lose so many things.
Got it. Got it. What you said has also sort of, brought another question to my mind, and I'm going to ask that to Kamna actually. Kamna, there is this tendency to also say that everybody needs therapy. And there are some people who say that's not true. Everybody doesn't need therapy. No, so going forward in the workplace, and again, I'm deliberately focusing on the workplace, even though I know that it's kind of difficult to draw those distinctions. Do you see an increased kind of appetite to maybe corporations talking about ensuring that people get access to therapy? I can tell you from personal experience, I have seen that there's one company that I work for in 2014. It's an American company, change.org. They had this practice of paying for a therapist if each employee wanted to go for therapy. So that was 2014. And I understand that this is kind of standard in many companies as well. So do you see anything like that? Maybe this is a question I should ask Dr. Pathare as well, but I'll start with you.
I think there are multiple aspects to this now. It's a fairly multidimensional question. Would everyone need therapy? I think it's a very generalized way to say that, everyone needs some sort of a therapist or a person to go and talk to. I think you need to split it up into two parts. Therapy is it's a technique, it's a treatment modality which is to be utilized for individuals who have a certain mental health related condition which requires that therapy. People who are talking about that every individual may need the therapist are referring to the fact that culturally, socially, we have become a society where our connections have diminished, or the nature of the connectedness that we have with people around us is not necessarily the best. So we don't have the spaces where we could go and have the conversations that we would like to. which basically means that the friendships that we talk about, the relationships that we talk about, the nuclearization of families, which has happened over the years, and specifically more in the urban areas, has resulted in a situation where currently a lot of people struggle to find places where they could get the kind of support that they need, or where they could get the kind of inputs that they require to make decisions, make effective choices. And as a result, therapy or a therapist or a counselor becomes a person that they feel comfortable in going and talking to, because that becomes a space where they can confide, share, discuss, get some sort of a neutral understanding of what they could look at doing in that situation. But that would not mean that everyone needs a therapist. What we do need is greater connectedness in our society. We need to go back to our roots, the culture that we come from. We need to find ways to start getting to know our neighbors, build better relationships within the communities we are part of, so that this experience of loneliness, which has become such a pervasive part or experience for a lot of people, gets taken care of. So I think that's one part that we need to try and understand here. The second aspect I do feel is that when we are talking about workplaces, our workplaces talking about providing mental health support, yes, but like Dr. Pathare was mentioning, which Dr. Mehta was also talking about, workplaces are of so many diverse types. Certain workplaces have the resources, they're willing to invest in it, and it's an investment. And research has very clearly pointed out, and this is a very old statistic which is there, for every dollar that you spend on mental health, you get returns which are about $4 worth. So yes, it is an investment that is worth making and which organizations should consider. Would every organization have that bandwidth to be able to provide that platform to all of its employees? Not necessarily. But the other aspect also is our country, and we're specifically talking about India here, does not necessarily have those many experts. We have a significant dearth of experts available within our country who would be able to provide those kind of effective services as well. So what is also probably required and needs to be thought about is how do we probably start training or providing ways in which psychological first aid can become an integral part of the skill building that happens within workspaces, which would allow people to provide the right kind of support within the system itself. And this has to be a top-down approach. Like Dr. Pathare was saying, that it's become about the individual. The individual needs to work on themselves. We need to start changing that approach that has come about, and we need to start emphasizing that it has to be top down, needs to be within the system, it needs to be integral to the organization to talk about mental health, to invest in mental health, to make it, to create awareness around it, to initiate ways in which conversations can happen, to provide psychological first aid, and to also, of course, look at collaborations with external organizations who provide such services. We provide such services as well as at Otis, but that will not necessarily be the only solution. It has to be a multi-layered solution, which I believe, and I'm sure Dr. Pathare would be able to also, I would add so much more to this, I was sharing about.
I just want to add to our panelists, if you feel like jumping in, feel free to jump in. Let it be a free-flowing conversation. So if you want to add to what she's saying, please go ahead. Otherwise, I have two areas I want to focus on.
Let me jump in since you made the offer.
Okay,
because
please
I've
go
been
ahead.
kind of itching to jump in for a while. Okay, I think it's much more complex than what it is. Okay, so to your original question was, is there too much of medication and is there too much of therapy? Which is really what you're going on. And the answer to that is complex. At one level, yes, there is too much of medication and there is too much of therapy. At the same time, equally, there is a whole bunch of people who do not receive the treatment they need. Either it is medication or therapy. I mean, we know the National Mental Health Survey, for example, showed that 90% of people in this country with a mental health problem don't receive any treatment at all. So, you have, it's the same thing that you have with, like, say, the malnutrition and the obesity issue. We have a problem with malnutrition and stunting, and we equally have a problem with obesity. Too much of it and too little of it coexisting at the same time. And I think that is really what happens with mental health. There is too much of it and coexisting with too little. The other issue is that also mental health problems are complex in the sense that they are not necessarily like, say, a physical health problem in some ways, because so many years, like the NIMH had a whole decade of brain and spent some $5 billion trying to find out the biological substrates of mental illness and haven't actually managed to find anything at all. In fact, even the researchers and psychiatrists in US are very critical of the fact that that money spent has not actually delivered anything. So it's complex. It's not just biological, and very often the social factors tend to be far more prominent. And I'll give you an example of it. During the pandemic, for example, in countries like India and many of the low and middle income countries, even in South Asia, have seen suicides go up dramatically. Okay, like our suicides in 2020 went up by 10%, which is a huge jump because they were like at 1% up and down here and there. And same thing you notice in Africa as well as in Southeast Asia. On the other hand, if you look at countries in the West and especially North America and Australia, suicides have not increased at all during the pandemic. And the big difference, if you might want to look at it, was the provision of income support, for example. So, there's evidence from Brazil, for example, that if you provide good quality income support, they did a study with cash transfers with 100 million people over 15 years, found that suicides among people who received a cash transfer was down by 60%. Now, the fact is that no mental health interventions reduce suicides by 60%, but a cash transfer does. So my point is that, yes, people need mental health support. People need individual support. They need the counseling. They will need medications at times. But let us not forget that it happens in the context of a larger social thing, which if you do not address, then those individual supports are not going to work. It's really, and that's why I said it's complex. It's not an either or issue. It's not about, oh, should we do this or should we do that kind of a thing.
Yes, I'm glad you made that distinction between too much and too little, and I want to focus now on the too little aspect. And by the way, if anyone has any doubts about my own perspective, I get health. I go for therapy, so I'm a big believer in help and support in the mental space. Mental space is such a weird word, no? Anyway, the point is, the question there are two other things I want to ask, which is the insurance sector. One can get medical insurance for a certain set of ailments, but I don't know what the scene is in India, in corporate India, and of course in government, in governments, whether that kind of policy is in place. So, Dr. Pathare, I want to start with you again in this, which is, what is the policy scene here? And of course, I do want to point out that 90% of India's economy is informal. So when we're talking about corporations, we're really not talking about the majority of India, but I'm asking you that question.
Right. Well, I'm glad you asked that question. So what does the law state? The law is very clear that there should be parity for insurance. Okay, parity meaning if you're providing insurance coverage for certain health conditions under certain conditions, and the same conditions should apply for mental health too. So, for example, if you said, if you have diabetes, we will allow you treatment for diabetes, but only after 4 years because you have pre-existing diabetes, then you should allow for mental health on the same condition. So the idea of parity is that you treat both physical health problems and mental health problems on an equal basis. Now, although the law came in 2017, the IRDA has really not done enough. So they keep on saying we've sent out a circular, we've got insurance companies to respond. The fact of the matter is that most of the insurance companies which have responded have either been because there have been 3 or 4 insurance companies which have now removed the mental health exclusion, for example, out of their policies. So you can get mental health care. But a lot of it has happened because of action in the courts. People have gone to court and said, listen, my policy still has this exclusion. And, the Delhi High Court had a very good judgment last year, which said, as of 2018, any health policy, even if it had an exclusion, because the exclusion is against the law, it would not hold water. So, the insurance company was making an argument, well, you signed the policy, it had an exclusion, you should have seen it, kind of stuff. And the government said, well, you can't sign a contract which is patently illegal. You can't have conditions in a contract which by the law of the land can't happen. So, in many ways, effectively what that judgment says is that anyone who's got a health insurance is covered for mental health. Now, the problem you have with mental health is different slightly. what happens in India is that health insurance is largely catastrophic health insurance. It covers for inpatient admission, really. Very few health insurance policies will cover outpatient treatment, although there are a few, okay? Now, the point is that what happens with mental health is most of the treatment is outpatient treatment and not inpatient treatment.
Right.
So your health insurance policy might cover mental health, but since 90% of the people take outpatient treatment, it's not getting covered. So that's another issue. In fact, I would say that corporates have been far better. Okay, even before the law came in, the corporates would negotiate with insurance companies and remove a lot of these exclusions. So for example, corporates, when they got group insurance policies, removed, for example, the pregnancy exclusion. They would get the mental health exclusion removed. So they would get that removed. So for many people who work in private corporate sector with large group insurances, they've always had mental health cover, and some of them even have outpatient mental health cover. So what I would, so it's that. And in the public sector, the answer is very simple. Ayushman Bharat actually covers, there are 13 packages of care for mental illness, which are covered in government sector. They don't cover it in the private sector, though. They say you have to go to the government hospital and cover it. But they cover a large chunk of the inpatient admission costs that will come in. So, in some sense, we are having, it's patchy, it's not complete, but it does exist. Now, if somebody wants to really look up, if you want to buy a health insurance policy, and look up and say, look, what is my health insurance policy cover, or is it good enough for mental health or not? You can go to our website. We've created a searchable database of some 500 health policies which are there. And if you put in the name of your policy, it will show you what mental health coverage it provides, and also show you which are the best insurance policies at the moment for mental health coverage. So, you can do a search and find it out. I think people will have to make that effort.
Yeah, if you can be kind enough to write in the URL,
sure.
While I go to the others. Dr. Mehta, I mean, I don't know if any of you want to say anything on the insurance aspect, right. But I do have another, sorry.
I will just, basically, what Dr. Pathare is saying is very right. The problem comes at the point of implementation also. Right now, in the previous month, I had 2 patients. One, the insurance doctor will not know what is happening to the mental health of the person. They will ask idiotic questions, multiple questions, same questions framed a time and again, or in different language, so that they can drop the insurance, so that they should not pay. So in that way, the doctor who's treating becomes a doctor, as well as he has to see the administrative part also. So the doctor themselves start saying, boss, medical insurance may not get covered. Because the insurance companies, in order to deny the insurance, will ask multiple questions and the same questions time and again. While on the other hand, there are many corporates, like our hospital is associated with Maruti, they cover the mental health easily. So there is a concept in the insurance sector how to deny this. That is the part which has to be taken care of.
Yeah,
and that denial is basically the lack of investigations in the mental health sector. What I can see, because you cannot prove it, you have to come and see it. They won't come and see it in the hospital, so you cannot prove it with the test. So that is another, because the people tend to misutilize such things. So it is a bias toward that.
A huge area of concern. I'm glad you brought that up. I'm going to shift to another topic, and I also want to be mindful of everyone's time. It's 5 p.m. So far, we've spoken about a number of interesting. We've gone down many different rabbit holes, as they say, and there are a couple remaining. We're going to stop this discussion and go to the keynote to end the entire day at 5:15. We're going to go to the keynote. So we have about 14 minutes, and this is a reminder for the audience. There is no such thing as a bad question. Please write in with your questions before I ask anything. And I think, Dr. Mehta, you want to say something.
And I must appreciate that this is the one of the first kind which is everything is on time.
Oh, thank you so much. Yes, all our guests were on time, and the conversation went ahead smoothly. Thank you so much. So I want to ask the next question, which is, okay, we are doing this conference in English. We have 22 official languages and hundreds of unofficial languages. How are we going to break the language barrier in India? And so is there any capacity? Is the capacity very limited? Do we have qualified enough people to talk in multiple languages, whether it is Hindi or Marathi or Tamil or Telugu, Kannada, Bengali, Assamese, it just goes on and on, right? So how do we break the language barrier in India when it comes to mental health? I'm assuming that a number of people, and I do know that words like anxiety and depression and whatever else, there are multiple words people use to indicate that same feeling, right? And we have lists of those words, but do people have a language to express their feelings? And starting from there all the way to, is there enough capacity in the system to even begin to start talking about mental health care in multiple languages? And is there a capacity within organizations, governments, public health, public sector, and so on? So I want to get all of your comments on this. I want to start with Ms. Chibber.
If I start with the first part of the question, that would everyone have the right vocabulary to be able to communicate what they're experiencing? I think people do have a certain language that they have available to themselves, and that's their colloquial way of expressing whatever it is that they're going through. Would it necessarily resonate with every type of expert? Not necessarily, and which is what makes it very important that we need to have experts available who can be able to communicate with people in their own language. That's a given. We all resonate with that aspect. There are, of course, people who are trained to use their own language to be able to provide the kind of treatments that are required by individuals. And case in example is that we run a 24-hour helpline, which is available in 14 national languages, which is run by experts who are trained in mental health, in psychology, in psychotherapy, in psychiatry, and they are providing those services. I think what we do need to start understanding is that despite some of these availabilities, it's still that we have a dearth of experts, and that is not something which is getting compensated for today or tomorrow. There's a huge gap in the services that we do require. Like Dr. Pathare also pointed out, 90% of the people who do require mental health services do not receive those services as well. The kind of gaps we are looking at are enormous. And while we do recognize that services need to be available in the language of choice of the individual, I think we have a large way ahead of us. And maybe some of the things which are going to be helpful is, for instance, digitalization. The whole pandemic, the last 2 years, what we have realized is that digital platforms can be utilized, something which was talked about, which has actually gotten implemented. People are being able to utilize experts' help and intervention from very far off places. That's something which is happening. We are being able to make some inroads into that space. We have to look at how do we create programs which could train other experts who are working within the field, where, say, for instance, a psychiatrist or a psychologist may not be available. How do we do that? That is going to be of critical importance. Can we look at collaborating with Anganwadi workers? Can we look at collaborating with ASHA workers, providing training systems? I think, in fact, Dr. Pathare, their organization does extensive work within grassroots, in the grassroots space, and they go into communities and they do a lot of training. So those are the kind of things that we do need to also push for. And a lot of those programs are run in local languages, because we know you can't build a connectedness within the community and you can't help the people unless you're going to be talking to them and communicating them in ways that they will understand and you will understand what the experience is for them.
Understood. Dr. Mehta and then Dr. Pathare.
Right. As Ms. Chibber said, basically, definitely there is a large lacuna. On the other hand, we are getting cosmopolitan and the language barrier is decreasing slowly and slowly. Hindi and English is being spoken by various and multiple persons. It is only in the rural context, which are too much inside, where the language barrier is of much importance. So while there are psychiatrists and psychologists at every level, so if they are working nearby, then the language, if they are working in their own state, then the language barrier will cease to exist slowly and slowly. But definitely the workforce is very, very deficient.
Okay, Dr. Pathare?
Yeah. So look, I mean, it depends on what you mean by language. As Dr. Rajiv Mehta said, Hindi, English, people talk the language. I think that is not really the issue. And do people have a language for their distress? I think they do have a language for distress. People are able to express their distress in many languages. But if you took language in a much more broader sense, then do people talk the language of the professionals? They don't. And do the professionals talk the language of the people? Then they don't. And I'll tell you what I mean by that is that conceptually, people in our communities, and not just our community, across the world, we've seen conceptually, people will not classify their problems as, oh, I've got depression, kind of, and I tick these 5 criteria that the DSM has got. That's not how they think of depression, or they don't have neat categories of depression or anxiety. Oh, I have anxiety, I don't have depression. It's not that. So increasingly, a lot of people across the world have started saying that, look, let's take a trans-diagnostic approach to this whole thing. Let's not get into saying, oh, have you got depression, or have you got a mixed anxiety, or have you got anxiety? We know there is a cluster of these symptoms which go together, and that's how people express their distress. So people do express their distress. They do have a language. They may not have the jargon that professionals have for it. And the professionals sometimes are unable to understand distress unless it can fit into their pigeonholes of what diagnostic categories they've made. I mean, don't forget, at the end of the day, the DSM diagnosis is, or I always call the DSM diagnosis as a camel is a horse designed by a committee. Basically, they keep on changing the diagnostic criteria every few years, because the reality is, if your diagnostic criteria do keep on changing, is because we really don't know enough about what are these categories. So there are broad syndromes that we should be talking about, and addressing distress for people is what we should be talking about. And that language actually exists very well, even with the non-experts. You might be actually very good at understanding and expressing and working with somebody who is experiencing mental distress. And paradoxically, that might be also because you're not a trained mental health professional, because you're not kind of then stuck into the jargon of mental health that professionals get stuck into. So, we need to really get past that kind of divide of unless you have a particular diagnosis, I can help you. Distress is distress, and people need help, and we should be providing that help. And as Kamna said, that we are never going to have enough experts to help everybody. And so what we've been doing very often is actually working with community leaders to try and provide training and support. And we have enough research evidence to say that what are called as lay workers, they are volunteers or even sometimes paid people. And many of our volunteers are hardly educated up to the 10th grade of school. They are very good. They're equally good at times for mild, moderate symptoms, as good as any expert would be, with very little amount of training in that sense. So, I think we should really, the real challenge is at the bottom of the pyramid, so as to speak. That's where the challenge is. And there's no way you're going to have, look, America has the largest number of mental health professionals in the world. About 20% of the world's psychiatrists, or 40% of the world's psychiatrists practice in America, which has a 4% of the world's population. And yet the US has a treatment gap of about 20 to 25%, which means 20 to 25% of people do not receive the treatment that they should receive. So clearly, just increasing the number of professionals is not the solution to addressing the whole issue. You need to broad base how we provide help, where we provide help, who is provided with help, and what help is being provided for.
Yeah, it reminds me of what Ms. Chibber said about a little while earlier about, we're living in a world where the nuclear family has really meant that we've lost contact with community and other infrastructure, so to speak, that can help us. So we've spoken about the bottom pyramid, and I suppose there's no need to talk about the top of the pyramid, because they're getting all the help that they want. And we started with mental health in the workplace. So let's close on that note. There are 4 minutes remaining. So can I just get sort of concluding remarks on where you believe this is going to go, and where trends should go? in the workplace. So I'm going to start with Dr. Rajiv Mehta and then come to you, Dr. Pathare, and then end with you, Ms. Chibba.
See, basically, slowly and slowly, the acceptance is going to come over. As we are getting westernized, so similar Western trends are going to come over, and the acceptance will increase. And slowly, the people are going to accept the therapy part, the label part, the therapy part, and the medication part. And the future seems to be bright in that manner. But a shadower in a manner of that increasing mental health issues will be there.
Got it. Dr. Pathare?
Where we should go, I think, really is for all employers. I mean, since we are talking about workplace, is for all employers to actually start taking a more broad-based perspective about mental health issues in the workplace, and not purely see it as a productivity tool or as a purely a welfare tool. While it might be a productivity tool and a welfare tool, it is also about creating better, healthier working spaces for everybody. So that's where it should go. Where I'm worried it'll end up going is that we'll take a very reductionist approach to it and say, well, you've been provided with either with a prescription or with a therapy kind of, here you can go and have this therapy and it's paid for, while completely ignoring the broader context in which things are happening.
Okay. Ms. Chibba?
I absolutely resonate with what Dr. Mehta, Dr. Pathare pointed out. And I truly believe that what we do need is greater awareness, bring in acceptance, create access. And like Dr. Pathare was pointing out, it should not be about what an individual can go and do for their own selves. Start looking at the system, start looking at the organization, and what is the kind of cultural environment that you can create over there? What are the kind of initiatives that you can bring in, the right kind of intent to create an environment which facilitates, maintains people's mental well-being? I think that's of crucial importance, and which will in any case automatically reduce the pressure on the mental health delivery system as well, automatically.
Okay, that's a great note to conclude things, but I've noted with interest that the Q&A box was filling up in earlier conversations. The number of participants hasn't really changed. So people clearly do not want to ask questions. So I'm going to ask a question on everybody's behalf. Okay, and so I'm going to ask you all that question, maybe one or two questions. Maybe we can sneak in a couple of minutes before we have Dr. Nachiket More delivering his keynote. So let's say I want some kind of help. Who do I go to? Should I go to a family doctor? Should I go to I don't know if there's any such thing as a family doctor anyway. Should I go to the nearest doctor and ask for help? Where does the mental health journey begin? And reverse order, I'll start with Ms. Chibba and then Dr. Pathare and Dr. Mehta.
One thing that we advocate at least is usually go to any qualified person, any doctor who you know would have some sort of an understanding, talk to them. They will be able to direct you to the right expert. A lot of people get confused between, should I go to a psychologist? Should I go to a psychiatrist? If you're experiencing distress, if there are certain things which have been troubling you, if you see that persistently your productivity or functioning is getting impaired, reach any doctor that you do need. They will direct you to the right person. Any person who's a trained doctor will have the expertise to be able to guide you into the right space. That's how I would suggest people should approach it.
Okay. I'll add another question to it, which is, okay, but we go to the nearest qualified person. But what if I don't know? Is it easy for family members, for example? Is it ethical for a family member to say to another family member, you should go and see this person? How does a family member who wants mental health intervention for another family member, how do they tackle this question? Maybe I can get Dr. Mehta and Dr. Pathare and whoever wants to jump in, basically.
Yeah, I mean, look, it's complicated, Venkatesh. First of all, when we say mental health problems, we are not talking about one set of problems. It's not like we're talking about just diabetes or just tuberculosis. You're talking about a whole host of conditions which might range from some minimal anxiety to somebody having a much more severe problem like schizophrenia or a bipolar illness. Okay, so clearly there is a whole range of problems, and what help anyone will need will vary according to which problem you're talking about. But my usual answer to anyone who says, I think I need help, my answer to them is usually along these lines, which is, let's say you got up one morning and you had a little bit of a flu and a runny nose. What would you do first? The first thing you'd probably do is just do some home remedies, isn't it? You're not going to just rush. You're not going to get up and put on your coat and get into the car and say, let me go and find a doctor. I've got a cold. I've got a runny nose. You're not going to do that. You're going to do some home remedies. You're going to do something to help yourself. You'll try for 3 or 4 days. And if that runny nose still doesn't go away, you might ask some friends or colleagues or something, listen, it's just not going. Do you think? And then they'll suggest some other remedies which you might try for another 3, 4 days. At the end of which somebody will say, listen, this is not getting better. You better go and see the doctor, okay? And you'll go and see your family doctor or a GP nearby who might say, oh, take these pills for 3, 4 days. And if it doesn't get better, then you go back after 4 days and say, listen, I'm not better at all. Maybe at that point he will say, okay, you know what? I'm going to ask you to go and see the specialist at the hospital, the chest specialist, because your cough is not going away. It's now nearly a month or 15 days or 20 days. And that's the process in which people receive help for physical health problems. And I think almost a similar process should be followed for mental health issues. You know, you don't want everyone rushing off to see a psychiatrist or a psychologist when they've got an equivalent of a cough and a cold, which is going to get better in 4 days. You don't want to do that. So you want to actually have this very stepped care kind of an approach to the whole thing, so that people move up a step depending on how they're responding. And so that's what my advice would be to anyone like you, and I'm assuming anyone like you, meaning people who come from a certain class and of society where you have access to lots of things like internet, you have access to friends, you have a social network, you understand mental health to some extent, that kind of stuff. So I think you need a range of things. You need to start with the easiest stuff, which is self-help and some home remedies for your mental health issues, to asking your friends to help you, to asking your local doctor, and then maybe seeing a specialist.
Okay. We've just had 2 questions come in while you were all speaking, and I've got permission to maybe ask a couple of more questions, assuming, of course, that it's okay with you all. So, Ms. Chibber, at what point do you know if one should go and get therapy? Question by anonymous attendee, and then I'll ask the next question to Dr. Mehta. Actually, you know what? Before you answer that, Ms. Chibber, I want to prime Dr. Mehta for this question, which is Ipsita Parida is asking, what is being done on the employer front and encouraging more employer assistance programs like they have in the US, and ensuring that employees feel safe and they are able to access care more readily. So, Dr. Mehta, if you think about, yeah.
This question will be better answered by Dr. Pathare.
Okay, I will
answer your previous question. I can answer your previous question, how to make the other person go to a doctor.
Please do.
Your family member go to a doctor.
Answer that question, then I'll go to Ms. Chibber. Right. Yeah.
See, basically, initially you talk to that person that your behavior is changing. Previously, you were like that. Now you are like that. Get his resonance. Get his yes. And when there is a yes, let's talk to somebody who's well aware of this field. We may not start the treatment, but let's discuss it. And once he is ready to go, then everything will settle. Number 1. Number 2, definitely the family physician is one of the best person to talk to initially. But when you go to the family physician, generally what happens in India is they will write the medication. They will not discuss about the diagnosis and other things. And most of the psychiatric diseases are being treated by the other specialists in India. So when you go to any specialist, do ask about the diagnosis. What are the diagnoses he is thinking of or making of, and what is the specialist?
Got it. The at what point do we know one should get therapy, Ms. Chibber?
Right. Individuals, like Dr. Pathare was also saying, that distress at the end of the day is for us very, very indicative of whether an individual needs to seek any support or help. If you don't have individuals available around you, distress is mounting, you're experiencing that your functioning is getting compromised across the different domains of your life. It's affecting your moods, it's affecting your thought process, it's affecting your responses to situations, and you're struggling to be able to cope with the situations, it would be indicative of seeking help, support. If these are situations where you need to make active decisions and choices, therapy could certainly be helpful. And you need to figure out, and a lot of times, even within, when we're looking at mental health related illnesses, when an individual is taking psychiatric treatment as well, as an adjunct, psychotherapy is also indicated across a host of conditions, and that is automatically recommended by the treating doctor as well. So those would be the indicators broadly.
Definitely.
And Dr. Mehta, I think I interrupted you. So,
Other words, basically, when there is a behavior change and when it is continuous and it starts impacting your social and occupational life, then it is the time to seek a help or a therapy. Number one. And number two, the research says definitely what Dr. Chibber is saying, psychotherapy plus pharmacotherapy, both going together as the best result.
understood. I think, Dr. Pathare, I'm going to ask you if you don't mind answering that question by typing it out. It's in the Q&A box by Ipsita Parida, because I want to be respectful of everyone's time, and we have our keynote speaker, Dr. Nachiket Moore, with us. So on that note, I'm going to thank you all. It's been a tremendously insightful and exciting discussion, and it's only the beginning, as we can see that we are living in a post-pandemic world, and hopefully there'll be more and more acceptance and at faster rates and faster speeds going forward. Thank you all very much.
A very well moderated session.
Thank you.
Thank you, Venkatesh. Thank you for asking.
Thank you so much. Thank you.
Bye-bye.